Good morning and welcome to Crack the Mic podcast with Agent of Change, DeCorey Davis. And this week's segment is entitled Diversity in the Foster Family. The foster care system here in the U.S. is often referred to as being flawed, quote unquote, by many experts in the area of human services. And suffice it to say, when we compile the lack of diversity that we see with respect to the families or caretakers that provide those services for the agency, it makes it a double entendre. Because, as we know, the data itself demonstrates that the lack of importance for cultural competence in the foster care system can lead to foster kids having a lack of strong and cultural identities that we know is linked to things like greater self-esteem and reduced levels of stress. And to help me further this discussion, I have a very astute panel that includes former City of Miami Commissioner Jeffrey Watson, Dr. David Bullock, professor, social commentator who has contributed to syndicated press like USA Today, Russia Today, just to name a few. Also, we have Charmaine Guerriere, child welfare trainer and diversity trainer coordinator for Citrus Health Network, one of Florida's largest mental and behavioral providers. Also, certainly last but not least, Ashley Samuels, mental health therapist. Good morning, guests.
Good morning.
Good morning.
Good morning.
Okay. In 2021, according to the Black Children, an article by the Black Children in Annie E. Casey Foundation, in 2021, Black children represented 14% of the total population, but 23% of all kids in foster care system. By comparison, white kids represented 49% of the nation's child population and only 44% of its foster care population. Latinos and Hispanics, however, represented 26% of the kids nationwide, yet 21% of all kids in the foster care system. So let's just delve in this conversation if we may. Now, before I ask this first question, I'd like to preface it with this song that was playing, the theme song actually for Annie, in which she suggested the following, that it is a hard knock life for us. But for posterity purposes, I'd like if you guess or the panel can answer the question. In your opinion, who are the kids? Those, when she said us, that are in the foster care system, and why are they there? And what are their needs? And quite frankly, are their needs being met? Charmaine?
Hi, good morning. Thank you so much. In Florida alone, I heard you talk about a lot of the statistics, and I just want to point out, in Florida alone, there are over 20,000 children living in the foster care system. And that experience is undoubtedly the most traumatic time of their lives. And here at Citrus Family Care Network, we have actually partnered with the Casey Foundation in order for us to address systematic disparities so we can improve the outcome of the children and families in our community. The children that we're talking about is the children of our community, the children that we see every single day going to school, going to work, going to church, going to our local restaurants. So we're talking about all of our youth. We're talking about all of the children, including our own, including ourselves, right? Those of us that grew up in this community. So I believe that
Absolutely.
we're talking about all of us.
Absolutely. Thank you for sharing that, Charmaine. Dr. Bullock, you want to share your sentiment on the question?
If you could just rephrase the question for me, please.
Absolutely. In your opinion, Dr. Bullock, who are the kids that Annie in the video or in the movie where she suggested it's a hard knock life for us? Who are those kids that she alluded to us? Who is she referring to? And is the system properly addressing the needs of those kids? In
Well, I
your
think it's a
view.
very complicated question. A great question. Who are the children that Annie's referring to? I guess if we're talking about the United States of America, we would definitely be talking about children in the child welfare system. But we might be talking about children that are not in the child welfare system as well. Globally, we could be talking about children around the world. Um, but, I think if we hone in on the topic for today's session, if there is an environmental hazard in the home, a hole in the floor, holes in the wall, rats and roaches in the home,
Right.
that's a problem. If there are persistent incidents of domestic violence between the paramour and the partner, or between the husband and the wife, or the wife and the or the lovers, then that adversely affects the children. There may be sexual abuse.
Absolutely.
There could be neglect, and so um, I think sometimes it's hard for people to really imagine the kinds of challenges and experiences and traumatic events that are occurring in families, in homes that affect children. And of
Right.
course, the system isn't perfect, but that's the wrong question. The question is, where would these children be without a system? And so we
Absolutely.
have one. It needs some support, as all systems do, but thankfully we have some response.
Absolutely. I echo that sentiment, Dr. Bullock. You want to go ahead and share your thoughts, Mr. Watson?
Yeah, I think that if you go back to the movie, which became a very popular song, "It's a Hard Knock Life," when she's talking about kids like her in that system,
Right.
clearly that system is representative of kids, as the doctor said,
Mm-hmm.
have had problems at home in their parental environment, be it double or single parent,
Mm-hmm.
and now, for whatever reason that might be, they're in a system that's probably never going to be a perfect system
Mm-hmm.
or an efficient. But rather than living on the street, it's going to be sufficient. And so I think to have something, and it's
Mm-hmm.
always such that on the lower economic strata
Mm-hmm.
of our country,
Right.
those systems that should be in place are never going to ever be sufficient enough for the people who are in them,
Mm-hmm.
and always be shortchanged by the public policymakers that have to ensure that there are protections for them. And so strengthening the system
Mm-hmm.
is something that's necessary. But, a lot of cultural differences come into play as relates to that.
Right.
And
Right.
so she was talking about people, kids like her who are in those programs,
Mm-hmm.
and it really does, because there's all kind of iterations of
Mm-hmm.
where people might be,
Mm-hmm.
and so it may not be the best.
Right.
Some foster kids go from a parental home environment
Mm-hmm.
and get into a foster care environment, and it's almost worse because those people are looking at it not to take care of kids, but as a second income. And when they
Wow.
start taking on 12 kids, they're making money off the program and off the back of those kids. They're not necessarily caring for them, but they're providing for them an opportunity themselves to make money off those kids. And so we have to now do some changes from a policy perspective for those who are working in this area on a day-to-day basis, from a policy perspective, so that you can now take what is probably a traumatic experience and help make it a better experience.
I couldn't agree with you more because it's definitely the expression I like to use is we wouldn't want to take them out of the frying pan and place them into the fire. So you want to go ahead and share your thoughts on that question, Ashley?
So thank you all for having me again. So when I think of Annie and the things that she's saying in that movie and that song, she's talking about the kids who are experiencing the same thing she's experiencing. It can be a number of different things. No doubt, probably something traumatic. As everybody on the panel has already said, children who typically end up in group homes and foster homes have experienced some sort of abuse, whether that's physical or sexual. They might be experiencing neglect. In some cases, it's abandonment, incarceration of one or both parents. But I think that at the end of the day, it's whatever's deemed to be whatever DCF deems it to be. So there have been situations where kids were left in the home where those things were happening, in other situations where kids were removed from the home in less traumatic situations. So it's whatever DCF deems it to be. Number one. And she said it's a hard knock life for them because it is difficult. You're away from the majority of your family. You might have moved away from your school. You might not have your favorite clothes or toys, or things that make you feel like comfort items. And so that's a hard life for any child to live. And they're more likely to have to grow up more quickly than they should. And their innocence is lost. So I think that that's what she means. She's talking about this hard knock life.
Okay. All right. Thank you. Thank you for sharing that. Okay. We'll go ahead and take a brief commercial break, and we'll return in just a moment.
At Immaculate Home Healthcare, we recognize the important role home plays in healthcare, which is why we are dedicated to helping you and your loved ones heal at home. Together, we work with you, your physician, and family to help make the transition from hospital or facility care to home care a smooth one. Our team of highly skilled health professionals includes nurses, therapists, aides, and medical social workers that have been chosen for their compassion and commitment to care. They undergo rigorous background checks to ensure that only the most dependable and trustworthy staff serve you. People turn to our home health care for help with services like post-surgical care, wound care, chronic disease management, diabetes, pain management, and hypertension. Home health care costs less than hospital or facility care, and Medicare pays 100% for qualified patients. At Immaculate Home Health Care, we provide quality medical care in the comfort of home. Call us today at 561-372-9108 to discuss qualifications and payment options, or visit us online at www.immaculateHHC.com. We'll be happy to help.
All right. Well, we want to thank our sponsors, but let's just go ahead and proceed with the conversation. Now, according to iFoster.org, they suggest that the foster care system is meant to provide a temporary arrangement in which trained caregivers, including kinship or relative caregivers, provide for the care of a child when their biological parent or parents are unable to care for them. So let me just ask you this question. What is the purpose of the foster care system? And if you can share the intricacies of how it works.
I mean, I think the purpose of the foster care system, as the last panelist just provided us with an insight, it's designed to give some sort of relief. I wouldn't call it a complete safety net, but relief to kids who've been either orphaned by parents who are now not in place, and they're not in place for a lot of reasons. And so it's designed for these kids now to have a easier, if not softer, landing rather than to be completely on the street and taken a complete advantage of by the streets.
Right.
And so, as stated before, that's what it's designed to do. How they now compensate people, allow for people to have more than should be managed in an environment where you have so many different sort of kids now all living together.
Right. Right.
Is something that has to be now, looked at and assessed for its impact on the kids. Sometimes, what we do is we rather have a aesthetic sort of look.
Right.
They're not cared for, as opposed to how sufficiently are they cared for.
Right.
And when you don't have that problem in and of your own, if you don't have that problem and you're looking at it even as a public policymaker, you can't really understand why a kid has been abandoned, why a kid's in a system like that.
Right.
And so consequently, you're not trying to do the sort of things that are necessary to ensure that they're protected.
Right. Absolutely. I definitely agree with you on that. Mrs. Guerriere, you want to go ahead and share your thoughts on that question?
Yes, I do. Thank you for that. And I agree with what Jeffrey Watson said as well. A lot of times people think about, the foster care system and, that it's broken and we have a lot of things to do in order to fix it. But for me, I have this half full mentality, right? I'm a half full type of person. And I think that a lot of things that we thought the foster system was set out to do, I think we're a little bruised, or like we say in the islands, right? Like it's a little screwed up right now, right? And I think we're at a place where we're expecting this foster care system to fix issues that the community should be protecting and providing. And that's what it was for. It was based for the community to come together and rally around our families who were in need, right? Who abused, abandoned, or neglected their children. And I think that that's what we started as, and we kind of strayed from it. And I'm so happy that in Florida, we moved to a more of a private system where it could be more community-based, right? Where the community has the power, because the community knows what the community needs, not really government and systems. So I think the foster care system was created for that the community can rally around the family, where they can be the village that the family really needs in order to help them to, like Mr. Watson said, be a soft landing for their children so they're not being raised by the system.
Right. But now let me just play the devil's advocate for a moment, if I may, for fair and balanced reporting, because many proponents are not advocating for the privatization of the foster care system because of the lack of oversight. So what do you guys and ladies would have to say to the lack of oversight that we will see if the government continues to monitor it as it has in the past? Would that really alleviate a lot of the molestations and et cetera that's taking place? Or
you'd be somewhat surprised. If I remember correctly, a couple of the cases have been highly profiled here in Florida, where kids were lost, and people visited and they didn't see them and they didn't follow up. So sometimes the balance and accountability of a system is better when you can hold someone else accountable, as opposed to an internal sort of mechanism that will not allow for colleagues or what have you. Now, not say that colleagues do that, but government systems like a foster care system program are always going to be underfunded. That's just the nature of how it works. Look, in municipalities of any size, the first department cuts Parks Department.
Okay.
That's the first one cut, right? And so if you're going to fund the system that works for these kids better, you're going to have a greater opportunity for more success than was probably chronicled at this point. Because, ideally, like I said before, my experience has been, an observation has been such that most people who are caring for kids, particularly in the African American community, are caring for them for money. They're not caring for them.
Right. Right.
And let me not be, too and overstate. I don't know numerically what that looks like, but I would say that the vast majority of instances where you see problems, kids are even trying to get out of those homes, because when you take and put together, sometimes you take sisters away from sisters, brothers away from brothers, sisters away from brothers, and you put them and place them in their separate places.
Right.
Then you have a lot of consternation among the kids, because it's very difficult. I mean, you have a problem with your own kids in your own house. Now you take on a number of different sort of personalities,
Right.
and it becomes very difficult to deal with. And we in our community, that's why you see a lot of, and I'll go to the professionals, the balance is tipped towards older foster kids that look like you and I, because you get a certain age, then no one wants to take in basically a person who's already formulated their mind. And that becomes an issue as well. And that's why you have some of the problems you have as you go downstream in the program.
So let me ask you this question, Dr. Bullock. So what is the rule, you would say, or because we know a lot of disproportionate number of Black and brown kids in our foster care system, and sometimes they're moved to different zones, schools, and locations, and what impact can this transition have on their psyche, in your opinion? Honestly.
Well, great question. I think interruption can be very traumatic on children, particularly the kind of interruption that happens when they are sheltered from their home, and then placed, say, with a relative, but not their mom or their dad or their parents, or in a group home, or in a therapeutic foster home, or in a foster home. So interruption can be very traumatic. And I think, there's always the question of, we want to do no harm, but at the same time, we want to have safety, well-being, and find positive permanency for children. And so we have to strike the balance between the two. But I think, there are larger questions here, I think, that go beyond, say, the child welfare system.
Right.
That speak to society at large. And if we're talking about America, and if we're talking about, say, Black folks in America, then we have to talk about how public policy has changed since the 60s and early 70s.
Right.
We have to talk about the inclusion of African Americans being integrated in the political, social, and economic systems.
Right.
And we have to talk about still the persistence of racism and the persistence of color prejudice, and the persistence of racial disparity. And so all of that as an extra layer on, say, just trying to help a child who maybe is being molested by their mother's boyfriend get out that house and be safe. Also, like one of the other panelists mentioned, as children age, I mean, it's harder to find folks that want to adopt 16 and 17-year-olds, 15-year-olds, or sometimes children of color, sometimes children that are Native American. And so these are very, very difficult problems. I think we just need to keep it simple and ask this question. If you were in a home not being fed, not being changed, not being spoken to, not being cared for, would you rather endure that trauma? Would you rather endure that trauma, or would you rather someone come in and interrupt that trauma and get you somewhere where you can be fed and where you can be safe? And so the intention of the welfare system, I think, is right. And so we have to build up the infrastructure and the institution around the intention.
Couldn't agree with you more. Thank you for sharing that. All right. So let me just ask you, if I can, Mrs. Guerriere, do you feel that there should be more online training and support for foster parents? And if so, why or why not?
Absolutely. I think foster parents do need more training and more support because they're taking on this big challenge. They're taking on this big deal. Here at Citrus Family Care Network, we're the lead agency for the child welfare system in the southern
Right.
region, and we deal with prevention, we deal with foster care, we deal with licensing, and we deal with adoption. And part of my role is training. And a lot of times we need training not just on our jobs, but also training on empathy, training on how to deal
Absolutely.
with our families,
Right.
training how to deal with the trauma that our families are seeing. You list out a lot of data on how even though our Black and African American youth are in the smaller population numbers in the child population, they're overrepresented in the foster care system. And we need to train people on that. We need to have people to understand what happens after you call.
Right.
At Citrus Family Care Network, we have an initiative addressing child welfare disparities. And we've done some geo mapping. And in our 33142 zip code, 33147 zip code, 33055 zip code, those are our highest call-in areas.
Right.
And
right.
we need people from those areas to understand, like, hey, it's from your community.
Right.
What can we do to help support these families? What can we do to prevent them from being a part of the foster care system? And then when they do come in, how much do you understand about their plight? How much do you understand about their day-to-day activity, the trauma they're dealing with, the gun violence, the mental health, the substance abuse?
Right.
I think foster parents absolutely, and our relatives and non-relative caregivers need more training and understanding and support into what our families are dealing with.
I definitely echo that sentiment. Ashley, you want to share your thoughts on that question?
I wholeheartedly agree with Ms. Guerriere.
Okay. All right, short and sweet. Would you like to go ahead and share your comments on that question, Mr. Watson?
Well, I mean, yeah, it goes without saying, in a non-perfect world, to the extent that you can steep yourself in what you're supposed to be doing, you're going to do it better. So, look, should they have online training? They should have online training. They should have classroom training. They should have some sort of physical assessment. Because not everybody is equipped now to deal with kids.
Right.
Some adults can't deal with kids. And so now when you take the combination of, and I don't know if the ladies on the panel who are steeped in this see this, but when you take the combination of people who are in a position that are not emotionally qualified to be in that position, what then does that do to the kids? And now you're not there for the kids, you're there for the money. Well, they're liable to do anything. So that doesn't help the kids at all.
Absolutely.
Like I say, you take them from one traumatic experience to another traumatic environment. And so, yes, those people should have all three things. So you'll find out very quickly how well the kid's going to be taken care of by a personal visit, an assessment of some sort, right? And training if you think they're sufficiently capable, but making sure they do all the right things for the betterment of taking care of the kids.
Absolutely. I couldn't agree with you on that. But let me just change the tides for a moment, if I may. And I want to ask this next question. What is the role? Because we know a lot of disproportionate number of Black and brown kids in our foster care system. And sometimes they're moved to different zones, schools, and locations. And what impact can this transition have on their psyche?
Of course, I think that it's definitely a concern. When I was engaging in my research about foster youth, one thing that came up is that typically foster care youth experience 2 placements a year, sometimes up to 3, and sometimes they're going to different zones, to different schools, or what may have you. There should be systems set up where, similar to homeless youth, even if you are considered homeless, your school is federally on the hook for providing transportation so that you can attend your regular school and have access to things, because school, we know, is one of the most stable environments for children, and perhaps incorporating similar laws into established policies for foster care youth might be something that is helpful. I know for me personally, I'm a social worker at a school. When I am made aware that kids are entering the foster care system, I do my best to make contact with that case manager so that I can then be connected with the family, encourage them to stay at our school. But we know that that is not always the case. Sometimes kids are taken from their house in the middle of the night and sent to a different place. So we do what we can, but I think that if we put more policies in place to ensure that there is some continuity in services, and not just education services, but also with mental health. One thing that I'm very passionate about is mental health. When it comes to kids in foster care youth, about 80%, from my understanding, experience mental health challenges compared to about 20% of your typically developing youth. And that probably is because of the trauma that they endured, not only in the foster home, but prior to getting to the foster home. And so it's not just about having a consistent school, but it's also about, can I stay with my therapist? Is that therapist too far away? Can I engage in virtual sessions now? What is being put in place to make sure that there's continuity in services for mental health, for physical health, for education? I think those things would be very helpful.
I definitely couldn't agree with you more on that. You want to share your thoughts on that question, Ms. Guerriere?
Yes, thank you. And I definitely agree with Ashley. I would like to say, all systems, there are issues, right? There's some that needs to be addressed, but as many bad things that we hear happening, there's also some good too. And I think we also need to look at the caregivers and the foster parents that are doing things right, and we can model from what they're doing and champion their style and their structure. I absolutely think when children are moved and they're having multiple placement, it does have play a part in trauma, in their separation. That's why earlier you heard me talk about the zip codes of our high removal cases, and we're trying to partner with the community to say, hey, we need foster parents in this area. We need people in this area, so we don't have to have our kids that's in the northern part of the county move into the southern part of the county and have it to be bused, right? Because we don't have enough of the foster homes in that area. So we're rallying, we're urging the community to understand that we have a situation and we need you. We need you to step up. We need you to understand what's happening, because we don't have the number of foster homes in the northern part of the county. Kids are forced to be placed in the south part of the county. And if they're there and they're having to be bused to school and we have a problem with transportation, that's a lot. That's a lot of concern when we're talking about changing schools, changing their environment, their community. They can't go to the extracurricular activities or the faith-based communities. And speaking of faith-based, we are rallying behind the faith-based communities to let them know these are your people. These are your people that attend your churches. These are the people that attend your services, and we need you all to step up so we can support the family.
Absolutely. Well, guess what? We are out of time, unfortunately, for this discussion, Diversity in the Foster Family, Part 1. But guess what? I want to remind you to like and share this video. And again, I want to thank my sagacious panel, former City of Miami Commissioner Jeffrey Watson, Dr. David Bullock, and also Charmin Guerriere, and mental health therapist Ashley Samuels. And I want you to tune in for next week. Again, this is your Agent of Change, signing off with Crack the Mic. Peace.
Me and old Hal have been together for a long time. Recently, I realized that I could use some help with basic everyday tasks, but Hal depends on me, and I'm not going to leave him. I don't have to. Yes, that was good news, wasn't it, Hal?
Immaculate Home Health Care can give you the help you need so you can stay safely and comfortably at home from a few hours a day to round the clock. Call today for your consultation. 561-372-9108. 561-372-9108. Online at ImmaculateHHC.com.